Hello and welcome to all our listeners to an exciting episode of MedCare Today podcast powered by AMTZ, where we bring you the most insightful conversations from business perspective in the world of healthcare, pharmaceuticals, diagnostics, and medical devices advancements. In today's podcast, we have Mr. Anil Jauhri. He's the former CEO of National Accreditation Board for Certification Bodies, NABCB, India. Welcome to the podcast, sir.
Thank you for having me here.
Yeah, so since you are here, so I'm sure the people watching must have understood that what we are going to discuss today. So the topic would be, understanding and decoding the standards, the accreditations, certifications, and the approvals in the field of healthcare.
Yeah, sure.
So if you can just let us know in very layman's language, what is standards?
I would say a standard which, documents the characteristics of a product to make it fit for the purpose. A product should be fit for the purpose it is made. That's it. That's quality. That's standard.
Why do you think that standards are so important?
Well, standards are important because we need a certain benchmark for every product or service that we use at a certain level, driven by largely customer satisfaction. As a consumer, I should be happy with what I buy, whether it's a product or a service.
So when we talk about standards and certifications and approvals, how do we can demonstrate the compliances to certification?
See, I'll answer this in two parts. One is demonstrating compliance to a standard can be done by a business by what is called self-declaration. I implement a standard and I declare that I have complied with a particular standard. Second is by way of a second-party audit. My buyer, if I'm selling a product to somebody, he comes and he checks whether my product meets his requirements or not, and that's how I demonstrate compliance. And then finally, a third-party assessment, where somebody who is not part of this transaction, I am the manufacturer, I am supplying to somebody, there's a third party which is independent totally, which comes and checks compliance to the standard and certifies that I meet the standard, which is normally called certification. So any of these methods can be used. Second part is that there is demonstration of compliance as per regulations, which is compulsory.
Yes.
And there is demonstration of compliance on a voluntary basis, where there are voluntary standards. You still want to claim, beyond the regulation, you want to claim that I comply with some international standards. So there could be this kind of compliance as well, regulatory and voluntary compliance.
Okay. So in the Indian ecosystem of healthcare, how do you see these standards, these compliances, these accreditations fit in? Like, how do they play their roles?
See, healthcare is both products and services. And being healthcare, by any yardstick, healthcare needs to be regulated because everything, if the product or the service has to be safe. On product side, we have regulations under Drugs and Cosmetics Act. Fortunately, medical devices have recently been covered, so we are totally covered as far as products are concerned. On the services side, there is still a gap because we have a Clinical Establishment Act which is supposed to regulate services, but since services is a state subject, the states have to either adopt Clinical Establishment Act, which I guess 13 states have adopted, or they have to have their own act. For example, West Bengal has its own act, Goa has its own act. Under that, there is supposed to be minimum standards, which have not yet been notified for hospitals. They've been finalized, but they're yet to be notified. So there is still a gap on the services side in terms of standards. That's as far as regulation is concerned. On top of it, as I said, there can be voluntary compliances. On services side, the voluntary compliance is pretty well established. We know of NABCB accreditation for hospitals, and there are some more accreditations as well. On the product side, think of standards like ISO 13485 for medical devices, or think of standards like WHO GMP for pharma, which may not be part of the regulation, but you can get certified to WHO GMP. So there can be voluntary compliances as well.
So how can we establish? What do you see that it's a way forward that we can establish?
No, the first thing is having regulations. There's very little doubt that we need regulations in healthcare, both sides. The the entire value chain should be regulated. So whether it's on the healthcare side, for example, hospitals, wellness centers, clinics, all kinds of services are there which need to be regulated. We already have regulations, for example, on the education side. All medical colleges or Indian systems of medicine, they are all regulated. But there are a whole lot of training programs going on which are not regulated. So some attempt has been made by creating voluntary systems of certifying training providers. For example, Yoga Certification Board has system of certifying training providers.
Yes.
On the product side also, it will always be endeavor of every manufacturer or a service provider to not only comply with regulations but to claim something more, that he's doing something more than regulations. If regulation is a leveler, everybody's, a Chyawanprash from a known manufacturer or from an unknown manufacturer is the same because it's regulated. Now I want to claim something more. So when it comes to that, then they look at some voluntary certification. What can I get? For example, pharma industry goes into ISO 9001, ISO 14001. Medical devices, there is a standard ISO 13485. Although it's part of regulation also, but still, people do claim ISO 13485 certification. So that's how it will be always. There will be regulated products and there will be voluntary certifications. People would like to claim more. And when they claim more, they ought to, as I said, they can declare by self-declaration. But third party represents one good way of demonstrating that you are being evaluated by an independent body and you are complying with certain standards.
Okay. So, like India, it's a unique population, unique, needs. So, can you give some examples, like other countries internationally, which are those countries or which are those places where, those kind of regulations, standards are really brilliant? Like we can take an example as.
I think typically we always felt that in developed economies, the standards are much higher, whether it's US or whether it's European Commission, Europe. So one would say that's the place to look at as far as excellence is concerned. The best thing is if we can incorporate international standards into our regulations. That's where developing countries will struggle to incorporate international standards. What happens in India is that almost every sector, I think, we find it hard to implement international standards. But 20 to 30% of our businesses are world class in every sector.
Yes.
So it's possible that even if your regulations are not pitched to the international standards, you could still create a voluntary system to at least recognize those 20 to 30% who are world class so that they can get that recognition in the market. Because if your regulation is same for everybody, then if I am world class and our regulations are not world class, I don't get recognized until I prove in some other way.
So we are talking about healthcare, but just for understanding for our people, can you give an example in other sectors, which is one sector that India is really doing when it comes to standards and accreditation?
Well, our accreditation is a tricky term in terms of healthcare. We should first understand that difference. We use the term healthcare accreditation in healthcare, like NABCB accreditation or QAI accreditation, or ISQA, is the international body which is overseeing this accreditation. We use the term accreditation also in education. We have heard about NAC accreditation or NB accreditation.
Yes.
But the accreditation in ISO terms is different. That is accreditation of bodies which are certifying or inspecting or testing. So as an accreditation body, for example, as NABCB, we are one level removed from the industry. I don't go to the industry. I don't go to medical device industry or pharma industry, do anything. I accredit the certification bodies or I accredit the laboratories. The certification bodies go to the industry and certify. The laboratories test the samples from the industry. Whereas in case of education and healthcare services, NABH goes to the hospital directly, although it calls itself accreditation body. Okay. NAC goes to the universities and colleges directly, although it calls itself accreditation body. So we have to understand this difference in accreditation as we talk about accreditation in healthcare. We use the term certification, where certification body goes to the industry and certifies, whether it's product, whether it's ISO 9001, whatever. In our system, what NABH does or what NAC does is actually certification and not accreditation the way we see it. So that distinction has to be understood. Lots of our industry, as I said, in any sector, textile, food, the manufacturers who are exporting in the global market to EU, to US, they are all world class. I mean, I was in Export Inspection Council, and seafood certification is done by Export Inspection Council for EU. It's a designated competent authority.
Yes.
And I've been to some seafood plants. It's wonderful to see those plants. Absolutely world class plants. So there is a whole lot of, in every sector I would say, India has a certain percentage of industry which is world class.
Great.